Hi, I'm Dr. David Blumberg. I'm a colorectal surgeon with the medical group at Montefiore St. Luke's, Cornwall. Patients at risk, the average risk population is that anyone over the age of 45 is at risk for having colon polyps, which are precursors to colon cancer. In addition, unfortunately, we're finding that the youngest patients in the millennial group tend to have an increased risk compared to any other demographic. And in addition, those patients have a higher risk of developing rectal cancer, so are at risk for needing more complicated surgery if they have rectal cancer, and oftentimes because symptoms are late, they present at a later stage of diagnosis, making it more difficult for them to recover fully from their cancer surgery. So anyone who has any unexplained rectal bleeding, or rectal bleeding for that matter, anyone who has a change in bowel habits where there's diarrhea, constipation, if there's needs to really get an appointment and seek help to evaluate them. Patients who have any family history of colon polyps, inflammatory bowel disease such as Crohn's disease or ulcerative colitis, as well as a family history of colon polyps, also may need sooner evaluations as well. We have a comprehensive cancer program that is designed to treat patients with colon cancer and rectal cancer. For those patients who have colon cancer, the treatment is surgery first, followed by possibly chemotherapy. Not all patients need that. For patients who have rectal cancer, oftentimes a different approach is relied on, where patients will get radiation and chemotherapy first, and then depending upon how they respond to the treatment, may or may not need surgery. As a surgeon, I operate on patients who have colon cancer and rectal cancer, and in addition, I specialize in minimally invasive surgery or laparoscopic surgery, which means that we provide surgery with very small incisions as opposed to the old-fashioned surgery where it's a big cut, which means a longer recovery. So with the smaller cut surgery, it's a much quicker recovery, generally about 3 days in the hospital.